Good morning and welcome to episode 250 of the On Air Advocate, where at the On Air Advocate, we look to provide education, support, and empowerment for all of those with different abilities, mental and medical illnesses, and their caregivers. For those of you who may not know me, my name is Tammy Flynn, and I am the host and producer of the On Air Advocate. And I am super excited if you are joining us here this early Friday morning, or whether you are catching this on the replay. Now, as always, if you think any of the content that we are talking about today could be relevant for anyone in your network or your circle, please hit the share button on whatever social media application that you are watching this from. Well, today I am super excited because we are kicking off our Marfan Awareness Series for Marfan Awareness Month. And I am excited to have, for the first time here to the show, Dr. Bitterman. He is the Assistant Professor of Orthopedic Surgery at the Donald and Barbara Zucker School of Medicine. Welcome.
Good morning. Thanks for having me.
Yes, and thank you for joining us early this morning. I do appreciate that. As we kind of, dive into getting to know Marfan, which is the topic of this interview today, this is the first time you've been on the show before. So I'd love for you to give the audience just a little bit about your background, as well as your connection with the Marfan Foundation.
Sure. So my name, as you said, is Adam Bitterman. I'm a board-certified, fellowship-trained orthopedic surgeon with a specialty focus and interest in the lower extremity, basically from the knee down. My fellowship training was in foot and ankle, so I handle a lot of sports injuries, deformity correction, soft tissue injuries, basically involving the ankle and the foot. My connection with the Marfan Foundation is just through volunteering and then ultimately getting involved. And now I'm a member on the professional advisory board, providing orthopedic expertise to my colleagues and to the Marfan Foundation and Marfan public as a whole. And so it's great to be here. I really appreciate the opportunity.
Yes, and when I was putting together this series, and obviously Marfan falls under that rare disease category, and I know in February we celebrate that here as well. Can you just kind of start out with giving people the basic definition, like what is Marfan?
So Marfan is a condition that falls under the umbrella of a connective tissue disorder. And a connective tissue disorder involves the tissue or the building blocks that basically create and hold us together. And that can involve blood vessels, that can involve ligaments, that can involve tendons. And those connective tissue items are not considered normal in someone with a connective tissue disorder. And so it gets inherited, or it is a random mutation, and it's considered a genetic disease or genetic disorder. So it's not something that's contagious. It's not something that you can pass along through close contact. It's something that is deep down inside through an abnormality in your DNA and your genes. So that is one misconception that I certainly want to lay out and make sure that people understand.
Mm-hmm. And is there, I know you said that the onset of it can be found as an adult or a child. Mm-hmm. If it is found earlier, obviously research, in hopes of doing research would be to hope to find out conditions sooner than later. Is there forms of treatment? Like how do you treat something like this?
So it depends on when it's found. And this is a very important question, and I'm glad that you're bringing it up. Diagnosis of Marfan syndrome or any connective tissue disorder is extremely important. What we are learning and what we know is that patients with connective tissue disorders, generally speaking, have significant involvement of the cardiac structures, the heart, the major blood vessels that leave the heart. And that vascular involvement is usually what leads, unfortunately, to the demise of someone. But with earlier diagnosis, with the latest and greatest technology, the surgical interventions, the medical interventions are much greater now than they were. So ultimately, that leads to people living a lot longer. And then what comes into play is someone's quality of life. So just taking a step back here is that the presentation, or what people see on someone with Marfan syndrome traditionally, or what has been mentioned in the past, is they're tall, they're skinny, they are disproportionate with regards to their arm length, their leg length, in comparison to their overall body structure. And that may lead someone to be suspicious for a further evaluation. However, that may vary. That may vary from one person to the next, from one diagnosis to the next. So certain people may not be diagnosed until a sentinel event in their 30s or in their 40s, and others may present earlier with an infantile presentation and be diagnosed with Marfan syndrome soon after birth. Bottom line is, as I said, earlier the better. Diagnosis leads to significant treatment modalities that allow people to live full, normal quality of lives and able to function. And that's where my area comes into play, because I focus mainly on quality of life.
And um, for the Marfan Foundation itself, and I know that you play a big part, in the role there. What are the resources that they have available to parents, or kind of like what's that first stop? Sometimes people say like, once I get the diagnosis, then what? Do you feel like the doctors, as they diagnose, they have good direction, or most of the time, because this is in that rare disease category, and like we were talking about before the show, it's only 1 in 5,000 that get diagnosed with this. Is the Marfan Foundation kind of that first stop after diagnosis?
So it's a great resource. That's number one. It's a great resource for colleagues that are in the professional side, and then it's a great resource for parents, brothers, sisters, families, aunts, uncles, significant others, what have you, to find out information. And one of the things that I take great pride in now that I'm involved is the approachability of myself and also just the other members of the team, whether that be the support staff, whether that be communications folks, or whether that be on the medical side. When I first became involved as a volunteer, there was no barrier between someone who did not know anything and someone who knew everything. And that is something I think that the foundation takes great pride in. That being said, when someone has a diagnosis or there's suspicion of a diagnosis, the website would be the first place to go. And then if a medical provider needs assistance in getting more information to either for themselves or for their patient, there's no better spot than the actual foundation personnel and foundation medical personnel.
Okay. And when we talk about research and accessible doctors that are very familiar with this condition because it is in that rare space,
Mhm.
is there places throughout the United States that specialize in that just a little bit more?
Yeah, there are certain academic centers throughout the country. I won't mention names, but certainly feel free to reach out. Depends on location. Um, in certain major cities, those major academic centers have a solid grasp on the syndrome, on the clinical manifestations, and are up to speed on the treatment. Others in other more rural areas may not be, and that's okay because we have these resources today, and now it's much easier for everyone to connect virtually, as we've learned, and so it makes it a lot easier.
And with getting a clear diagnosis, and I know we talked about this a little bit if we back up, is a genetic diagnosis? So would someone need to undergo genetic testing to have a very clear 100% sound that this is the condition you have?
So that's what I recommend. And I think that's generally speaking the important thing to pass along here is that genetic testing gives you an answer. There are certain criteria from the outside or the clinical criteria that give physicians and medical personnel a suspicion. And then based on symptomatology, based on how someone is presenting, based on their complaints, based on their overall physical structure, you then take it to the next level. So me as an orthopedic surgeon, where I don't really deal with anything from a cardiac standpoint, I've diagnosed it before and have encouraged appropriate follow-up with cardiac professionals, genetic professionals, and then they take it from there.
Okay. Okay. And when we're doing the genetic testing, some people that aren't familiar with it, across the board, would you say usually when you're doing the genetic testing, they're not only looking at yourself, but they're also looking at your parents and taking samples from them as well? I know when we did genetic testing for my son, that was the avenue we went, and we actually found out that one of the conditions that's under this umbrella, it's a predisposition from his father. So, for genetic testing, they don't ever just go straight to the individual. They do other family members usually?
Usually they may. I can't speak specifically for certain laboratories or certain protocols. I would yield to the genetics team on that, but they may try and get family involvement just to confirm. And as you said, for those that are listening, the umbrella connective tissue disorder includes many other diagnoses, many other sister and brother diagnoses to Marfan's. And that includes Ehlers-Danlos, Loeys-Dietz, and then some other inheritable connective tissue disorders.
Okay. Each of those have their own uniqueness about them.
That's correct.
Okay. So within this, just to kind of recap, when we're talking about if someone gets the diagnosis, they kind of reach out to the Marfan Foundation to find out more. What are the different methods of treatment?
So it all depends. Treatment depends on severity. Treatment depends on overall goals, and treatment depends on how involved the provider, the physician is. And certainly you want to make sure you're finding the right provider who has a fantastic grasp on this syndrome. And also treatment involves follow-up, because you need to have strict surveillance in place from a cardiac standpoint, from an ophthalmologic standpoint, from an oral hygiene and maxillofacial well-being standpoint, and pulmonary standpoint, and orthopedic standpoint. So a diagnosis kind of opens up the avenues, if you will, rightfully so, to other physicians and other providers and other subspecialties. But the treatment initially is, from my understanding, is blood pressure control. And again, I yield to the cardiac colleagues for that. But having your blood pressure be under control eventually, or ultimately, saves the pressure on the aortic wall, thus limiting the distension or the enlargement, which puts you at risk for the aortic aneurysms that we frequently hear about in our connective tissue world. So medication is key. Activity modification is critical, and that's been in the spotlight in the past 5 to 6 years, just based on individuals who have come out and have been public regarding the diagnosis. Certain contact sports you can't participate in anymore, mainly because of the deceleration activities, or the risk of significant injury to the thoracic structures and vital organs. So it's tenfold, but the critical areas include the heart and the vascular system.
And I know, I mean, I guess just for our personal journey within this and being underneath that connective tissue umbrella, we do, I think it's like every 3 years we do heart checks and stuff like that. So I'm assuming as doctors follow, this is something, as you get introduced to those new specialists that specialize in this area, that people are then followed up on every few years to make sure that everything is good.
Yeah, that's correct. I mean, cardiac-wise may vary. From my standpoint, it's usually annual, just for foot and ankle checkups, making sure that inserts are proper, orthotics are well shaped, and they haven't had too many miles on it, if you will.
Mm-hmm.
So yeah, roughly a year for me.
All right. And if someone is listening to this podcast or listening here this morning and they want more information, or they have direct questions for, yourself, what is the best way to either contact you, get involved with the foundation?
So I'm very active in social media, and I'm happy to touch base with anyone and everyone. So my Twitter handle is at Dr. Adam Bitterman, so at DRADAM BITTERMAN, or feel free to reach out via email, abitterman@northwell.edu.
Wonderful. And once we wrap up this segment, we can drop those things, below in the comments. We also definitely will link this up with the Marfan Foundation. So that's a direct access. And obviously, if somebody reached out there in their contact and said, hey, I saw this, they could get a hold of you as well.
Definitely.
If they reach out that way. Wonderful. Well, thank you so much, Dr. Bitterman. I appreciate you being with us here this early Friday morning at the On Air Advocate.
It's my pleasure. I really appreciate the opportunity to speak, and thanks for having me.
Yes, and we will be continuing this Marfan Awareness Series all month long. So I thank you guys for tuning in this morning. And if you guys want to know any more about the On Air Advocate, you can head on over to onairadvocate.com and find all of our resources right there. Or if you want to join our private community, you can head to the top of this Facebook page, if that's where you're watching this, and hit the blue button, and that will let you into our private group. Thank you guys so much, and thank you, Dr. Bitterman, again.
Take care.
All right, bye-bye.